Okay, assalamu alaikum. You're going to begin preparing the tooth, صح? Okay, have you given anesthesia?
Yes.
Yes, you've given anesthesia. How do you know the anesthesia is working?
By probe.
What?
Probe.
By probe? But if I place my probe here, I might traumatize the tissue, and the patient is not feeling anything. And by the way, buccally, it's not anesthetized by the ID. صح? Buccally, it's the long buccal nerve. So even I might take sensitivity from here. I need to ask the patient, is the tongue tingling and is the lip tingling? بلشت تحسي انه هون فيه راس لسانك بلش ينمل؟
لا تستني لا.
طيب شوف. Okay, so the lip is tingling but the tongue is not. She doesn't feel paresthesia in the tongue yet. My question, this is just a quick point about anesthesia. How do you know it's working? So you need to make sure that you have enough anesthesia. You might begin working and slowly, okay? If the patient feels any sensitivity, you stop and you might increase or redirect the nerve to the nerve if you have not given it correctly. Now, my question was here, how are you going to begin with preparing? My question was here. Are you going to begin with the occlusal or the buccal surfaces? Occlusal, okay. We teach in our school going occlusally first. When I'm going to go occlusally, I need to do orientation groups. Where am I going to use my orientation groups? Depth groups.
The net.
I'm going to do one here, and one here, and one here. And then I connect between them using planes. Don't go with the bear like this. This will create a flat cusp. You go with the bear from side and other side. Do I keep the marginal ridge in my preparation?
بعدين بشيلها.
You might begin by keeping it and then opening it, but it should be open at the end. Okay? Central groove should stay in its place. Okay? This is a 5. It has a minimum cusp here, like a mini cusp. صح? See it? This mini cusp? I could also keep it. I could also keep this morphology for this cusp, and I'll have a second cusp here. Okay? How do I know that I finished my depth of preparation?
Functional
Functional cusp. How much are you going to remove?
2 million.
Which is the functional cusp in the lower? البكل. This is the buccal functional cusp. 2 millimeter here, 1.5 here. Okay. Are you going to use your index? So how do I check that I've removed correctly? First by the orientation groups, the depth groups, and secondly I recheck with the index that I've done that. Okay? The grooves, where are you going to place them in the lingual? Remember that we said the lingual cusp is one cusp here and one cusp here. The first cusp, you place a groove here, one here and one here. Okay? Go with the 1.2 bear. This bear is 1.2. Okay? This is 1.4, you measured it. Okay, 1.4. I'm going to go 1.4 here, 1.4 here, 1.4 here. Then I connect them, okay? I'm going to consider this a second cusp and do 1.4 here, and then create a cusp shape, okay? Slope here and slope here. Open this marginal ridge. Once I finish, I feel that the grooves are almost wiped away. I need a bit more. I'll leave it for the finishing. Okay? I'll leave it in the finishing stuff. Yeah, begin.
طيب كثير إنه عمل 1.4.
Sorry?